Today, we're talking about an important topic, colon cancer. We're going to talk all about it, explain what it is, the risk factors, and the screening options. So with us today, we have Dr. Ron Landmann of Baptist MD Anderson Cancer Center. Thank you for joining us.
Thank you for having me.
Can you explain exactly what the colon is and what it does?
Sure, my pleasure. The colon and rectum are really the final or last portions of your gastrointestinal system. The function of the colon and rectum are really to help store food and waste products and also help absorb water. And when it's appropriate time to expel your stool or waste products, it allows you to do that at a more convenient time. So once your food and all the nutrients are absorbed, including vitamins, proteins, lipids, fats, and other nutrients, it goes into the colon concentrates it and compacts it, and then when you're ready to go ahead, it eliminates it when it's most socially appropriate.
Let's talk colon cancer. So what are some of the risk factors and warning signs that we should be looking out for?
So unfortunately, most colon and rectal cancers are actually found incidentally with screening colonoscopies. However, there are still many that are found when patients present with bleeding from the rectum, or when they see blood on a toilet paper with wiping, or in the toilet bowl, or if patients all of a sudden have thinner stools, more frequent bowel movements than they're used to. Some patients may experience weight loss. So it could be a whole variety of symptoms that many patients may just kind of put aside. But if you have these persistent symptoms for more than a week or two, it may be best to have this checked out by your physician.
And let's talk screenings. What are the options and how often should they be done?
So fortunately, there are a couple of really great screening options for our population. I'm going to talk about the average risk patient, meaning I'm going to exclude those patients who have a history of colon cancer or a history of polyps or other genetic diseases that are predisposing them to cancer. Mm-hmm. But for the average patient population, there are really two major options. The first one, which has been the gold standard, is called a colonoscopy. And that's when a patient is sedated, so they don't remember or feel anything, and a tube with a video camera at the end of it examines the entire wall or lining of the colon. This has the advantage of also being able to remove and or biopsy anything that's found that may be atypical. The second most common and recommended option would be something called a stool-based DNA test. That's something that you can do at home, where you collect your stool in a specimen container and send it off, and they analyze the stool for DNA that's suggestive of having an advanced polyp or cancer. If that does show to be positive, then patients do need to get that colonoscopy afterwards for more definitive evaluation.
Who is eligible? And how do you know which screening is best for each patient?
Sure. So for most patients, the American Cancer Society and other societies have now gone on board with this recommendation to move the screening age for colorectal cancer from 50 to now 45 years of age. So at most patients who are 45 years of age or older should start to get elective screening colonoscopies, and on average every 7 to 10 years. Should they find anything abnormal, your gastroenterologist or surgeon may recommend shorter intervals.
Are there other ways, though, that we can reduce our risk or prevent colon cancer?
So some of the best ways to try to minimize or mitigate your risks of developing colorectal cancer include watching what you eat. We know that obesity predisposes patients to developing colorectal cancer and other cancers. Smoking also contributes. High alcohol ingestion also has been shown to contribute to colorectal cancers, as has a sedentary lifestyle where you're not really exercising much. In addition, we found that diets that are low in fiber and high in red meats also may predispose patients to colorectal cancer. Other things that may contribute to colorectal cancer are genetic abnormalities and other diseases such as inflammatory bowel diseases, such as ulcerative colitis, Crohn's disease, something called hereditary non-polyposis colorectal cancer syndrome, and familial adenomatous polyposis. Those patients usually start screening even earlier than 45.
Let's say someone wants to set up a screening. Where do they go?
So Baptist Health is committed to the overall health of our community. If anybody has any interest or desires to make an appointment, we welcome them to come to our website at baptistjacks.com/colon-cancer screening, or they're also welcome to call 904-202-4U, the letters YOU, and we can help them to start the process of colorectal cancer and screening surveillance.
Okay, well, thank you so much for your time today.
Thank you very much.
Of course. And if you'd like to see this segment again or get more information, go to firstcoastliving.net.